Hello everyone. So, I am here again for this new lecture Pulse Polio program. In this program we will discuss about the objectives of this program, and after that we will discuss about some of the indicators, how to find the cases, what is acute flaccid paralysis. So, we will start with this program, which is with a global initiative of eradication of polio in 1988. Okay, following the World Health Assembly resolution. Okay. And after this assembly in 1988, we made Pulse Polio Immunization program, okay, which was launched in 1995. Okay. Now, children's, they are more prone for the infection, this polio. So, children in the age group of 0 to 5 years, they are administered polio drops, okay, during national and subnational immunization rounds. Okay. And our target, means how much we have covered, is about 172 million children are immunized during each national immunization day, which is on the 16th of March. Okay. Now, if we see the case in India, so the last polio case in our country was reported in Hora district of West Bengal, okay, with the date of onset 13 January 2011. Thereafter, no polio case has been reported, but yes, there are some strains which need to be eradicated. Okay. So, WHO on 24th February 2012 removed India from the list of the countries with active endemic wild polio virus transmission. Okay, so that we have prevented. So, we are not in the list of this endemic wild polio virus transmission, but yet there are some strains which need to be eradicated. Okay. Now, coming to the Pulse Polio Immunization program, the first phase was launched in this 1995 to 1996, first round on 9th of December, okay, 1995 and 20th January 1996. First PPI targeted children is less than 3 years of age. Yes. After that, our target we have changed. So, we have changed it from 0 to 5 years. So, later on WHO recommended the age group should be 0 to 5 years, okay, in this phase 1996 to 1997 we have covered this of age. Okay. Now, what is the pulse, meaning of this pulse? We will see what is the pulse. Now, pulse means the sudden or simultaneous mass administration of oral polio vaccine, okay, on a single day to the children of age group of 0 to 5 years of age, irrespective of their previous immunization. Okay. Now, coming to the intensive pulse polio immunization, how it is different with the normal pulse polio immunization. So, intensive pulse polio means intensification of PPI, which is done by adding additional rounds, okay, at fixed booths, okay, and they are followed by house to house survey. Okay. So, the health activists who are working on the society level, what they are doing, or the community level, what they are doing, they are going house to house and they are finding how many children are there at the age group of 0 to 5, and they will provide the vaccine, 2-drop vaccine. Okay. I think all of you are familiar with this house to house search or vaccinate component. Okay. So, success of PPI in India, pulse polio immunization is, with this number you can think of, yes, we have achieved some success. So, see 35,000 cases annually in 1995 to 1996. Okay. So, this is a very big number. Now, how we have reduced? See, nil case in 2013. Okay, this is showing, yes, how we have implemented our program. Okay. And this is only possible by house to house search and providing the vaccination. Okay. Now, what are the objectives? So, under this we will see the Pulse Polio initiative was started with the objective of achieving 100% coverage. This is objective, 100% coverage under OPV. Okay. Immunize children through improved social mobilization. Okay. Plan mop-up operations in areas where polio virus has almost disappeared, and even after that screening is important. Okay. So, we have to screen it even after the disease has eradicated or eliminated, and maintain high level of morale among the public to aware the people about the symptoms of the disease. Okay. So, that they can report it as early, they can get the treatment as early. Now, the vaccinations required the means there should be one storage storage facility. So, whosoever the person or health activist, they are going to house with the vaccination and they are providing it to the public, they are storing it in some of the equipments, that is known as a vaccine vial monitor. Okay. There is a freezing system. So, a particular temperature is provided, and through the vaccine vial monitor, there are some coloring system on these vial monitors, and on the basis of color they are identifying, yes, the vaccine is working, means we can provide it to the people. Yes. So, description means a simple tool which is a sticker on the OPV vial. There is one sticker, okay, which is showing some color. So, which enables vaccinator to know whether vaccine is potent, means it is good to give at the time of the administration. Yes, they are working well. Okay. So, on the basis of that color, they will identify it and then they will administer to the patient. Okay. It is mandatory since 1998 for quality assurance. So, basically you can say vaccine vial monitor is a type of system which is providing the quality of vaccine. Okay. Now, in the polio infection, this we have the cases of acute flaccid paralysis. Okay. So, we will understand what is acute flaccid paralysis, okay, and we will identify the cases. So, there are some terms or conditions, how we will identify the cases. First of all, we will understand what is acute flaccid paralysis. So, there are three terms like acute, flaccid and paralysis. Now, acute onset means which is less than 4 weeks, means which is for shorter duration. So, less than 4 weeks in a child age less than 15 years. So, I told you there means this infection is more prone in the children. So, we are taking the children of age group less than 15 years, okay, or any case of paralytic illness in a person of any age when polio is suspected. So, acute means which is less than 4 weeks. After that, the second term, yes, there is one another point with the acute, what is written, rapid progression of from onset to maximum paralysis. Okay. So, it will be means the symptoms are rapid and they will cause the maximum paralysis in a very shorter duration. Okay. Then see the flaccid. Flaccid means the loss of tonicity. Okay. Muscle tone is lost. Paralysis. Paralysis means weakness or loss of voluntary movement. Okay. So, the patient who is suffering with this infection, they are not able to walk properly. Okay. They are not able to do daily activities properly just because they have lost their voluntary movement. So, this is a problem in the polio. Yes. Now, if we have detected a one case of acute flaccid paralysis, so what are the other diagnoses which are very similar? So, there is sometimes confusion with this with the very similar symptoms. Okay. So, we will see differential diagnosis of AFP. This means not every time AFB means acute flaccid paralysis is a polio case. Okay. There are some other diagnoses as well which are causing the same thing, acute flaccid paralysis. What are these things? See, descending asymmetric flaccid, this LMN, okay, local motor neuron, okay, paralysis. So, lower motor neuron areas, this part is paralyzed. Okay. So, lower areas, limbs, they are affected in this descending asymmetric flaccid paralysis. So, this is also one of the differential diagnosis of AFP. Then there is a Guillain-Barre syndrome. In this, nerves are affected. Okay. Nerves to the brain or spinal cords, they are affected because of cytologic albuminic dissociation. So, there is a dissociation disbalance between the cells, normal cells or albumin means the protein content, they are disbalanced. Okay. So, due to the disbalance, there are the chances of disruption of this cerebrospinal area or the nerves of the brain or spinal region. Okay. So, they can also cause the acute flaccid paralysis, and sometimes they are taken in confusion with the polio. So, this need to be taken care. Okay. So, that is why we are reading it at here. Transverse myelitis. Okay. In the transverse myelitis, what is going? Of course, there is a flaccid paralysis and CSF is normal, sensory loss is there. Okay. So, the patient does not feel any pain, so there will be sensory loss. Bladder dysfunction is present. Okay. Traumatic neuritis. What is traumatic neuritis? It can be at any age, not only at the children. Only one leg is involved. Okay. And there are some non-polioenteric viruses. Okay. So, there are some non-polioenteric viruses which are causing the acute flaccid paralysis, and they are sometimes taken as confusion with the polio. This need to be taken care. Okay. Sometimes these type of infections are also causing the acute flaccid paralysis. Now, see acute case search in pulse polio program. How will identify the case? This is very important. Okay, identify the case and the contact the patient who had contacted to the people. We have to identify those people as well. Okay. Now, see active case search in the community. In the community where an acute flaccid paralysis case resides. Okay, where the case is living, where the patient is living. Where an AFP case has visited as well, we have to go for those places, we have to identify those patients as well. Okay. During the incubation period of polio, 4 to 25 days before paralysis, the same pattern you have seen in the COVID as well. Okay. So, we are trying to identify those cases the patient met with. Okay. And will provide the treatment as early. So, a house to house active case search is conducted. So, what is important here is how will identify the active case? By house to house active case search. Health officials, they will go to the home, they will identify the case. Okay. AFP cases that may have occurred. So, this activity is carried out immediately, will do it immediately with the ORI, means outbreak response immunization, will provide the immunization in the particular area where the case we have identified. Okay. Now, we have identified the case. So, I will talk about the sample collection. So, how will take the sample? See, adequate stool sample. So, for the detection of polio, we are taking the stool samples. 2 samples are taken in the time duration of 24 to 48 hours apart. Okay. So, adequate stool sample for every case of acute flaccid paralysis will find yes, there is a paralysis which is less than 4 weeks and there is a loss of involuntary movements. So, we will take the sample. Stool samples are collected, okay, for diagnosis of cases of poliomyelitis. 2 stool sample, when you will take, you have taken first sample and after the 1 to 2 days you have to take the second sample. Okay. Within 14 days of the onset of paralysis. So, try to do this thing within 14 days of onset of paralysis. Okay. How much is the sample? What is the quantity? It should not be less than 8 grams. So, each 8 grams adult thumb size weight you will take the sample. It should be taken in the clean dry screw capped, so that the biasness in the test that can be avoided. So, clean or dry screw capped container need to be sterile, no preservative transport. Okay. Media required. Now, after the collection of the sample, what we will do, will send it to the reverse cold chain facility. Okay. This sample is stored in this area, okay, where the temperature like 2 to 8 degrees Celsius is there. After the storage, we will fill one form which is called standard lab request form. Okay. This standard lab request form, they will receive the query, yes, there is a one patient, there is a one sample, we have the request has been acquired, and then they will start to take the sample or will do the test. Okay. outbreak response immunization, ORI. Okay. So, outbreak response immunization means where the case is we have identified, will provide the vaccination. So, following the AFP case, investigation and stool specimen collection will provide ORI. Okay. Now, children age 0 to 59 months means 5 years of age are given 1 dose of OPV regardless of their previous immunization. If the case has been identified, just give the immunization. Okay. Travel history of the child with AFP may be taken so that we can go to those of the places and identify those of the persons as well. Okay. And the symptoms we can check, we can already also provide the immunization. Okay. So, this is we are doing in the outbreak response. At least 500 children should be vaccinated, okay, under this outbreak response immunization. Now, see if I will talk about the follow up of acute flaccid paralysis case. So, the follow up duration is 60 days, means 2 months. Yes. So, 60 days follow up in case of acute flaccid paralysis. Who will do this? The district immunization officer, okay, DIO. They will visit every case of AFP 60 days, okay, 60 days after the onset of paralysis to confirm the severity, okay, to confirm the absence or presence of residual weakness. Okay, residual weakness means which is for permanent. So, weakness is for permanent, loss of involuntary movement is permanent. How these officers will check? There are 2 things you can see, mid arm circumference or mid thigh circumference area. They will check those areas, okay, and the wasting means the loss in the weight, that will show yes there is a problem. Okay. So, reveal wasting on one of the side, of course, it will show yes there is a residual weakness. The another thing, asymmetry in the skin folds or medial aspects of the thigh region they will see. Okay. So, these 2 things they will assess and they will identify the presence or absence of residual weakness in the AFP case, acute flaccid paralysis, okay, and this is done by the district immunization officer. Now, see, there are WHO indicators of AFP surveillance. Okay. So, WHO has given some indicators. There are 2 indicators you can see, 2 most critical indicators which is showing yes how the surveillance is going on. Okay. So, the first and second you can see non-polio AFP rate in children. Non-polio means the polio virus is not responsible, there are some other things, means what we have discussed in the previous slides of differential diagnosis. So, there are some other causes. Non-polio acute flaccid paralysis rate in children less than 15 years of age. Okay. So, the target should be more than 1 per 1 lakh. If it is, yes, we are doing, means we are programming, we are doing the surveillance. If it is not less than 1 per 1 lakh, then the surveillance system is probably missing the cases of AFP, of course. Yes. If we are not finding even the non-polio AFP case, of course, the surveillance is not, we are not doing good surveillance. Okay. After that, there are some there is again indicator reported AFP cases. So, reported acute flaccid paralysis cases with 2 stool samples. So, whosoever is a patient of acute flaccid paralysis, the patient is suffering with this condition. For those of the patients will take the 2 stool samples, okay, and the target here is, see, the samples which is taken from means less than 14 days since paralysis onset, the target is more than 80%. These are the 2 indicators. First, I told you non-polio AFP case should be more than 1 per 1 lakh. It should be reported like in this, or reported AFP case with 2 stools less than 14 days, that should be target should be more than 80%. So, these 2 indicators are by the WHO for AFP surveillance and laboratory surveillance. Yes. After that, see, there are some other indicators as well. Okay. What are these other indicators which is showing the surveillance? Okay. So, First is timeliness of weekly zero reporting. Timeliness means there are no case in a particular area. We have taken the stool samples, but there are no polio cases. So, that is a zero reporting, but we have to report them as well. So, they should be they should be reported at time in a particular time. Okay. So, timeliness of weekly or correct timeliness of weekly zero reporting, that should be more than 80%. Okay. If there is no case, report it. Okay. That is called as zero reporting. Second, reported cases investigated less than 48 hours of the report. Now, we have identified there is a one acute flaccid paralysis case. Okay. So, these are the reported cases. We have to investigate them less than 48 hours of the report. The target is more than 80%. We have to cover this population 80%, more than 80%. Third, then we will see the completeness of the zero reporting. Okay. Now, there is absence and we have to see it properly. So, there is a completeness of weekly zero reporting which is targeted more than 90%. Okay. What are the other indicators? Reported AFP case, okay, acute flaccid paralysis, follow up exam at least 60 days after paralysis onset, that should be more than 80%. Okay. So, these are some of the indicators we will do for identifying the AFP case or to implement our program in this way. Okay. So, like follow up for 60 days, stool samples less than 48 hours apart, okay, zero reporting, these are all of the indicators here. Now, AFP case that should undergo 60-day follow up. Okay. So, who are the AFP case who will go under the 60 days follow up? See, cases with inadequate or no stool samples, means at the time of the sampling we have not taken it properly or the laboratory results are not showing it correct, there are some confusion. So, these cases are undergoing the 60 days follow up. After that, the cases which are showing the vaccine virus from this stool, there are two type of virus. One is a wild virus, okay, means the patient is infected with a polio virus. Okay. There are the strains polio virus 1, polio virus 2, polio virus 3, patient is infected with any of these strains. Okay. There is a vaccine virus as well. Vaccine virus means which is associated with the vaccine of this polio. Okay. So, they are very rare, but yes, we have isolated the vaccine virus from the patient stool as well. So, for that we need the follow up properly. Okay. After that, cases of isolation of wild polio virus, the same I told you, wild polio virus means the patient is infected with these strains. Okay. Any case that the investigator thought was strongly suggestive of poliomyelitis. So, the investigator who has seen the patient or met with the patient, the investigator very well know, yes, the patient is showing the symptoms very much similar with this polio, and it is a strongly suggestive of poliomyelitis. At that time we will go for the 60 days follow up. Okay. Now, the other indicators, the part of the other indicators, they are also under the other indicators. We will see what are the other indicators here. Specimens arrival at national lab. Okay. So, I told you after the collection of the samples there is a storage condition, reverse cold chain reaction, reverse cold chain, and in the after that will provide it in the national lab. These specimens are provided, and the time duration should be less than 3 days. Okay. And our target should be more than 80%. Specimens arriving laboratory in a good condition. Good condition means that they are in the frozen ice pack. The volume should be adequate. Volume means it should not be less than 8 grams. Okay. There is no evidence of leakage or desiccation. Okay. No air is coming in the sample. Okay. There is no means, because if it is there, of course the results will be the results will not be correct. Appropriate documentation will be there. So, these are the specimens arriving in the laboratory in good condition. These are showing. Okay. If it is means we have to maintain all of these things, and the target should be more than 80%. Okay. Now, see specimens with the turn around time. Specimens means the stool specimens we are taking. turnaround time should be less than 28 days. What do you mean by turnaround time? When we have taken sample and when we are receiving the reports, this is the time between these two things is known as turnaround time. So, turnaround time is the time between specimen receipt or reporting of result. It should not be more than 28 days, it should be less than 28 days, yes. Target is more than 80%. Now, stool specimen from which a non-polio enterovirus, non-polio virus is, that should be, target should be more than 10%. Okay. If we are reaching all of these, yes, of course, we are doing a good surveillance. Okay. Thank you so much everyone. I hope this is clear to all of you about the polio immunization program and the indicators under this. Okay.